I was not ready to give up ophthalmology because I love it. I'm passionate about the field. And I said, what are the challenges that all ophthalmologists are facing? I want to give back to my community and I identified two unmet needs. One was um, a means of recruiting fresh talent, train them to become eye care assistants, and place them into practices. And the second one is because of the rising cost of doing business, as we identified, is to create a group purchasing organization.
Welcome to the Ophthalmology Experience Season 2, powered by Boost Patients. Today, we're joined by Dr. Cynthia Matossian, founder and also former medical director of Matossian Eye Associates. She's a respected cataract and dry eye specialist, and she's now leading GP Ophtho and also the American College of Eye Technicians while advising companies and boards across eye care. Welcome, Dr. Matossian. Welcome. Thanks for coming on the show.
Thank you very much for inviting me.
Yes, it's I love having providers on that also have been entrepreneurs and gone into the world of business of ophthalmology because it helps provide a holistic perspective of where administrators like me can help gain insights from physicians like you that bring that unique knowledge and experience. So thanks again for joining. Before we got started recording, can you show me that the eye chart cell phone case again that you
This
have?
is my cell phone cover, so
Yeah, I thought that was
everybody
really
knows
cool.
it's mine.
Is it to scale? So like, could you put it in front of a patient?
No, it's not really to scale, but it's always a great conversation piece at
Yeah.
parties or wherever I am. Everybody kind of knows, oh, this is, they call me CM for Cynthia Matossian. Oh, this must
Oh
be
yeah,
CM's cell phone.
that's very cool. Was that something custom or did you buy it somewhere?
No, I ordered it online actually, and each time I change my phone model, I have to get a new one.
Nice,
So this is
nice.
my probably 5th or 6th phone cover with that.
I saw that because I'm thinking of a little like a marketing something to give our refractive patients maybe after surgery that has like I can see now this line or something.
Right.
As you showed me that, I started thinking of ideas of how to make that a marketing or like a gift for patients after
It
surgery.
would be a great one, but it has to be customized to the
For
cell
sure.
phone model because you can't squish
Yes.
it to
Yes.
make it
Yes.
fit.
For sure. Yeah, that's true. There would be a lot of different models to account
Yes.
for. Yeah.
Yeah, so a lot of SKUs.
Yes. Awesome. Well, again, thanks for joining. I'm really excited just to kind of dig a little bit and get some of the insights of the things that you've done and also some of the current things that you're working on. Can you tell me? And this is the first time we've met. I want to understand a little bit about kind of the history, and it sounds like you have founded a practice and some of the things that you've done. Can you give me a little insight into that of who you are and when you started in practice?
I started way back many decades ago when it wasn't so common for women to be ophthalmologists, let alone be the owners of their own private practices.
Hmm.
So it was a bit, of a kind of a pathway that I was forging. And I started a practice with one lane. All I could afford was equipment to just get one lane fully operational, one visual field machine,
Hmm.
one technician, and one front desk receptionist who worked on a part-time basis. Because
Yeah.
all of that had to come from a loan, from a bank. And it wasn't easy for me because I had debts in at medical school, college, all
Hmm.
these things. So
Sure.
they looked at my financial history. They said, this could be a risky move. Let's not lend her so much money. Anyway,
Hmm.
I got just enough money to get a small, teeny weeny office and equipped it properly with the latest equipment in that time. and started to work extremely hard, listening to my patients, requesting referrals from them, connecting with them, taking lots of call at the hospital. Back in the day, that was one way for me to connect with a physician community because, as ophthalmologists, we're so isolated from our networking, referral catchment group of physicians. This By taking call at the hospital, I got to know the primary care doctors, the endocrinologists, the neurologists, and so forth. So they started to refer to me. The practice grew. We ended up with 3 locations in 2 states, with a total of 14 physicians at Matossian Eye Associates. And then a
Oh,
few years ago, I sold it
mhm.
to a PE backed entity.
Okay.
However, I wasn't ready to kind of step away completely from
Mhm.
ophthalmology, hence chapter 2 started.
Okay. And where in the country were you? Where that practice?
I'm in Bucks County, Pennsylvania, which is north of Philadelphia, about an
Okay.
hour.
Okay.
One of our offices was in Doylestown, Pennsylvania, the other 2 across the Delaware River in New Jersey, not far from Princeton.
Okay. Yeah, that's a great story. I always love talking to physicians who are also entrepreneurial minded because you bring a unique perspective, and I think sometimes understand and share the same pains that us, the administrators, also experience. So you understand, and you kind of you have a different view on things sometimes because, like you said, you're looking for financing, you're looking to make, where do I invest, where do I not, and who's
Mhm,
going to give me the money?
mhm.
Are any patients going to show up? Those are a lot of the
Ex
struggles that
Mhm.
that we struggle with. So I appreciate the perspective.
And I think it makes conversations easier with the practice administrator because I have my business hat on and
Mhm.
can understand your pain points. I'm not just looking at it from a clinical, surgical perspective
Right,
because it's different. You have to make the books work out at the end
right,
of the day.
right. Yes. Yeah, and I love having those conversations too with the physicians that I work with because I explain it like this. I say, well, you know, you're here to give great patient care, and I'm here to give you what you need to do that. And our, my we need to reach this goal and we need to hit this. That's just the push and the pull of what we do
Mhm,
together. So
mhm.
understand that ultimate goal is for us to meet in the middle, and then we continue to grow together. But you have it both of those perspectives in one, so that it can be very helpful. Um, so you've been doing this now for in ophthalmology for a while, and
Mhm.
you've been witness to the industry has changed, the challenges of the industry, and what those have been, and how those may have changed. It sounds like if it's just a couple years ago where you sold, you got to live the challenges of the COVID
Yes.
struggles and all of the how that just threw everything on its head as far as what our challenges are in ophthalmology.
Mhm.
What from your perspective, looking at the history of those challenges, what are some of the biggest pressures on eye care practices today, and how are they different from when you started?
I think there are quite a number of changes that I have been observing, Guido, compared to years past. Number one, I think loss of autonomy of the ophthalmologist. We are being removed from decision making positions.
Mhm.
We are being kind of sidelined from making major decisions in terms of who we hire to work within the practice and the way we treat our patients. Because if a practice has been purchased by a PE backed entity, there are higher powers, so to speak, who make many of the decisions. Obviously, by aggregating some of those responsibilities into a procurement specialist, into a COO that oversees multiple practices, you're able to shave down the cost, hence enhance profitability. But by doing that, you are changing the role of the ophthalmologist. Yes, we are still delivering eye care, doing surgery, treating complex cases, but the ability to decide what piece of equipment, when to integrate it into the practice, who I'm going to be working with are all being removed.
Mhm,
And consequently, I do feel a sense of frustration
mhm,
among my colleagues. Of course, I'm generalizing, but they feel loss of control.
mhm. Interesting. Yeah, that's an interesting perspective. I think I've heard similar stories, but I've also heard ones that paint a slightly different picture. And I think it probably depends from what my experience in these conversations is the type of agreement that you enter in with a group like this, and then what kind of managing or partner agreement that you agree upon whenever that group purchase you, where sometimes the previous owner physicians will still retain the ability to make ultimate decisions on the providers that you hire. Or so, just and maybe just from my chats with a lot of people, that's what I've seen is it really depends on how you enter in that agreement, if it makes sense for you or if it doesn't make sense for you. But I appreciate the perspective, your perspective of you're kind of now removed from that, especially since you've had it for so long. I'm sure that can be very tough for you.
But I don't see patients anymore, so
Right,
it's
right,
not
right.
really relevant to me. So that's one perspective. You're right. The other perspective that I was about to get to, Guido, is that some people who really disliked managing staff, disliked the HR component of their practice, disliked figuring out how to integrate a new service line into the practice and didn't understand the business concepts as well as their surgical techniques. They're loving it because
Mhm,
now somebody else is doing all that work and
mhm,
for them. It's a
mhm,
part of ophthalmology they really did not care about, but had to do it because they were the owner of a small to medium sized business.
mhm.
And now they can focus on what they love, clock in to see patients and do surgery and clock out and don't think about the practice anymore. So it's that yin and yang. It
Mhm,
depends on where you were on that spectrum,
mhm.
how your post merger and acquisition mindset is about what's happened. Does
Yeah.
that make sense?
Yeah, 100% agree, and that makes sense. I think it depends on, like you said, where are you on the spectrum of what it is that you want? Because
Right.
some physicians, I wouldn't suggest go open your own practice because I know that that's not something that's in their wheelhouse or they wanna deal with. Other
Exactly.
physicians are amazing at
Right.
making all those decisions because they're just more geared in that way, but there's no right or wrong, it's just where are you in your journey, and what do you want. um I think in the increasing challenges that we're seeing, that it's no secret, we're getting less, our providers are getting less money for what they do, and the
Mhm.
cost to do business continues to rise every year.
Mhm.
That's an equation of that's not going to end very well, right? Because and so you have people like me that, especially in a large practice like ours, takes on a large portion of the business side of the burden
Mhm.
of seeing this
Mhm.
picture. It's almost like
Mhm.
a car wreck in slow motion as it's continuing
Mhm.
going, as two
Yes.
cars are headed towards each other, and there is a lot of stress in that. I was telling my wife yesterday, at the end of the day, I was like, oh my god, I just feel like I've got the weight of the world on my shoulders because there's so many competing priorities,
Right.
concerns, personalities, struggles, staffing challenges, and it just, when you're the person that has to then soak it in, be the voice of reason, be the
Mhm.
logical one, make the right decision for the group, it's a tough spot. So
It's a very
in,
tough
in a
spot.
in a perfect union, hopefully there's wherever that physician is or wherever the PA group is or the administrator, where we can complement each other
Mhm.
and figure out how to best navigate these challenges together, right?
Exactly. And you really did a beautiful job of listing the challenges. I listed one, lack of autonomy versus being pleased and thrilled that they don't have to deal with it anymore. But you touched on two other ones that are key, which everybody is experiencing, Guido. One is decreased reimbursements. Two, at the same time, increased cost of doing business. Everything costs more. So obviously, the scale is like this: business costs are rising, reimbursements are getting slashed, and the profit margin is really becoming razor thin for
Mhm.
most practices. And it's leading to stress, it's leading to burnout. On top of that, the fourth challenge is in or lack of availability of technicians to do a
Sure.
lot of the work to whom we are now delegating, testing, diagnostic workups, surgical counseling. In the past, we didn't have as many diagnostic tools. Now we do,
Mhm.
and sometimes they have to be repeated, and setups for procedures in the office. A lot of stuff is moving into the office as opposed to being done at an ASC or hospital owned OR. So now we need even more technicians to be delivering everything that we do at a time when patients want the Ritz Carlton 5-star treatment,
Yes.
regardless of what is going on around you. Well, it's hard to
Mhm.
deliver the Ritz Carlton treatment on a very low reimbursement scale from commercial insurance payers.
Yeah, I think you said it right, and I would encapsulate that as an additional challenge is that the bar is always rising for
Mhm,
what the standard is as far as patient experience, outcome. It's just because of potentially more competition, increased technology, increased visibility, social media, the
mhm,
ability for people to connect and share ideas. Because you know the standard probably many years ago was I'm happy to wait 30 minutes or an
mhm,
hour to see the
mhm.
doctor. That's not the case anymore. I think
Correct.
we people are wanting to be
Right.
seen at the appointment time and are so the standards are going up. And so as you mentioned too, okay, the struggle of finding okay, maybe you're my therapist and I'm just providing so I'm unloading this on you.
But it's reality. It's not
Yes,
unloading. We are actually speaking the truth of what
yeah,
every practice in the US is facing.
yes. And it's the challenge of finding specialized staff to deal with all of the things that we need to complete on a daily basis and support that our providers need. Probably the largest one, as you mentioned,
Mhm,
it'd be trained clinical staff.
mhm, mhm.
Another one that I see are trained revenue cycle management staff
Right.
that understand the business of ophthalmology.
Mhm.
And I want to ask you, so you started, or you tell me your involvement with the American College of Eye Technicians. Is that something that you started with, you're working with? Because I think it's a very novel concept. Can you explain what that is and how you got started with that?
It's a perfect segue because we were talking about the challenges of finding staff.
Mhm.
When I stopped seeing patients, Guido, as I mentioned just a few minutes ago, I was not ready to give up ophthalmology because I love it. I'm passionate about the field. And I said, what are the challenges that all ophthalmologists are facing? I want to give back to my community. And I identified two unmet needs. One was a means of recruiting fresh talent, train them to become eye care assistants, and place them into practices. And the second one is because of the rising cost of doing business, as we identified, is to create a group purchasing organization, primarily, although not exclusively, focused on ophthalmology. So I'll start with the first one.
Mhm.
Um, s- th- instead of fighting for the same technician pool because there's kind of a, round robin going
Sure.
around.
They like,
One person
yeah.
leaves practice A to go to practice B for $1 more per hour. I said, what's missing is people becoming aware of this as a career field. I started the American College of Eye Technicians, ACET, American College of Eye Technicians, but we pronounce it asset because technicians are an asset to every practice. So it's a little play on
Yeah,
words.
that's cute.
And what we do actually is it's a nonprofit. We all volunteer. You can check our website. It's Asset Ed for education,
Mhm.
ACETED.org. What we do is we work with high school counselors, we work with high school mentors, faith-based organizations and youth-based organizations, junior colleges and community colleges, and we go to them and say, "Do you have people who may not know what they want to do, may not be interested in going to college, maybe don't have the funds to go to college, and they're kind of lost. They don't know what career path to choose." We recruit them. The tuition is $500. I mean, it's way below our cost per student,
Mhm.
but we do it to remove any financial barriers for these kids. They have to be 18 and older to matriculate into our
Mhm.
program. And we have a curriculum that's 8 weeks long. It's an online school that happens Monday nights for 2 hours, taught by COMTs, people with lots of experience as ophthalmic assistants and technicians.
Mhm.
And then at the end, our students, I mean, they get homework, they get reading materials, they get quizzes, and so forth. Even though it's 2 hours a night of didactic classroom time, the
Mhm.
additional hours of requirements to be prepared, submit your homework is about 4 extra to 5 extra hours per week. After 8 weeks, they take an online final exam, which
Mhm.
we purchase from the American Academy of Ophthalmology. We also buy each of our students the AAO book, the Medical Ophthalmic Assisting book,
Mhm.
as a guide, although our curriculum is significantly pared down and simplified, but they have that as a resource.
Mhm.
And then, if they're interested, we place them into a practice based on where they want to work, large or small practice. And we try to make the best match possible. And we make a deal with our students. We
Mhm.
say, if you stay through, complete the curriculum, take the final exam, and get placed and stay at a practice at least 90 days, we will refund you half of the tuition. So they get $250 back. And that's a good bite for them to kind of, stay on course. And where we get our money is through the generous donations from pharma companies, medical device companies. We get unrestricted grants to be doing this. And as a nonprofit, we're able to use that money towards our curriculum and recruitment. We have 11 graduates to date.
Okay.
And our next cohort is starting September 15th, and we have about 8 students signed up.
Quick break brought to you by Boost Patients. If you're listening to this podcast, you're probably a physician, a practice admin, or maybe someone on the marketing team, and you really have a singular goal. You want new patients, more consults, higher surgery volume. And oftentimes, when you want that, you think immediately about marketing, spending more on marketing, investing more in marketing. Maybe, but probably not. We've mystery shopped over 600 practices, and there's one commonality with all of them. They're not very effective and not very good at patient follow-up. So before you invest more money in marketing and more into that investment, you really need to understand how your practice is following up with new patients. So go to boostpatients.com, fill out the contact us form, and let me know that you want us to mystery shop your practice. We'll mystery shop it. We'll document how your practice follows up with your new patient lanes, and we'll share that information with you. Now back to the show.
Okay. Yeah. I think you're really onto something. I mean, that's amazing. And I love that you're doing that. When you said where you look for these potential students, I think that's amazing because there are some that are not 100% sure where they want with
Mhm.
their life, their career, and a career in ophthalmology. It can be very, very rewarding from from the technical aspect and just in general. And so I think it's great. And as you were talking, I was thinking from the perspective of the practice thing. Oh, I have a lot of questions here. uh, because from a price point, especially as you're working with sponsors, I mean, that's very affordable. I mean, if you could take, if I could say, well, we'll partner with an organization like you, and that'll start to grow the crop of technicians coming in, I would do that with my eyes closed. And especially, depending on, well, here's some questions I want to, we're going to vet it. So, what has been your experience in terms of the ability for students to grasp and learn in a virtual way, especially when it comes to doing that after hours on certain days of the week? Because when technicians come into the practice, it can be challenging to train
Mhm.
them even when
Mhm.
you've got them in front of you, and sometimes it takes them years to get the skills. So can you speak to a little bit about how much they're able to grasp over that format?
Because we knew they would not have hands-on experience, Guido, our entire format is simplified and what I refer to as foundational education. What does that mean? We go over the rules of what an eye care assistant is, the various opportunities to grow and become licensed, certified, and then options as literally the career is limitless in what one can do. They can go into pharma, they can become a sales rep, they can
Mhm,
become a practice administrator with
mhm.
additional training and getting an MBA and things like that. So we encourage them and let them see beyond an hourly wage.
Sure.
Give them hope and courage. That's number one. Number 2, because these people don't know this field at all, so now they're mesmerized and they're coming in wide-eyed. We go over the anatomy of the eye. We go over disease states that impact vision and eyes. We go over what types of equipment are utilized to test for different disease states, like visual fields for glaucoma. What is glaucoma? We have to look at the optic nerve. We talk about OCTs, color vision testing, and so forth. And we go over the entire workup of an eye exam.
Mhm.
We have lots of animations that we show them about equipment, about testing, things like that.
Okay.
And it's a classroom. So it's a lively conversation. Discussions are happening, questions are being answered. And then when they are placed into a practice, we tell the practice they have no hands on, but have the didactic knowledge. So once they get in there, the runway to become very skilled at how to move the joystick of an OCT because they know what a macula is. They know diabetic edema happens. So the pickup rate is a lot faster and the learning curve is significantly condensed. So they actually
Yes.
become more, let's say, they're able to generate revenue for the practice in a much shorter period of time.
Yeah, that's the answers my question. It sounds like what you're doing is you're bringing people into the field, but you're giving them a strong foundation with where to go into the practice and much more likely to be successful. Because because I do see situations where you bring in, and we try to hire for character. We want to get people who are the right cultural fit, but there's a lot to learn, and
Mhm,
it can be very
mhm.
overwhelming if you come in
Absolutely.
with zero knowledge. So I
Mhm.
love that. Yeah, that's a great concept. Building a strong foundation for bringing the next crop of ophthalmic clinical staff into the field. I like it. Because yeah, at first I was thinking like, well, wait a minute, how are you going to? We're not creating COAs here. We're we're bringing people into the field, and I love that concept. Where are you doing this? Is it in your area of the country, or is it
No, it's national. We
okay?
have graduates from Oklahoma to Puerto Rico.
Okay. Do can people reach out? Can you start saying, "Hey, can you do this in my community? Can you do this in our area?" Is that a possibility?
Absolutely. And we can start to look for community colleges
Uh,
or high schools and identify the guidance counselors and start to work with them.
okay.
And we also put our graduates before they graduate in touch with Jacopo so that Jacopo knows who they are. They continue to communicate together. This way, they're primed to become certified at some point when they meet their 1,000 hours on the clinic floor requirements. They know there are these levels to move forward. So they're being educated on that as well.
Okay. Yeah, that's I love it. That's great. And I think you mentioned a
Thank
little
you.
bit about career growth and giving that expectation for where they might go. And the reason I was thinking about that is because I think the wage expectation has been another challenge that we've experienced. So typically the wages of an ophthalmic technician are starting, depending on the market, somewhere that's likely to be competitive and with other industries that are completely unrelated that might not be as hard. So that's been the struggle for us is that we bring you in fresh into the field. You're like deer in the headlights. Oh my goodness, this is a lot of information to take in. And sometimes they're like, yeah, this is too more than I signed up for. Not seeing the bigger picture of where they could go as a career in ophthalmology
Mhm.
because they could go make $22 an hour doing something that's a little more mindless, right?
But if you then factor in the career opportunities that
Right.
lie ahead, and this is just an entry into that field, and if you have the
Mhm.
perseverance and you have the diligence and the motivation, literally the sky is the limit.
For sure. No, and I think that's a great that you do that because that gives them perspective of
Exactly.
it's not just they're not comparing just what I'm looking at today. They're thinking more towards the future.
Yes.
Uh, well, I'm interested really to see, and we may be talking after this to figure out how to come to
Sure.
it to our neck of the woods. uh, and and so let's touch more on cost, the cost of doing business, which the other part that you mentioned you went into is that the GPO and you're helping that. Can you describe a little about the work you're doing there and how you're helping with some of those costs, materials costs?
Absolutely. One way, of course, that practices can enhance their profits is to do more cash pay procedures. And this way, they're collecting that money. There's less cost to getting that dollar through the door because you don't need billing people to, collect that if it's
Mhm.
done on a cash pay basis. But not every practice does that. Not every ophthalmologist utilizes some of those service lines. So, another way to become more profitable in the practice is by lowering your costs. And how to do that? All of us use very similar products. We all use dilating drops. We all have computers. We all use copy paper. We all have different forms of diagnostic and procedural pieces of equipment. So I said, why can't we form a group? Hence, a group purchasing organization. I added optho at the end, so it's
Mhm, mhm.
gpoptho.com if you want to go on our website, gpoptho.com. It is free for all physicians and their office staff. I said, I don't want to charge my colleagues. Let them become a member. The larger the membership, the more buying power we have with which we can negotiate with different industry partners. And this way, industry knows that we're really working hard at keeping them top of mind for our doctors. They're so busy. These are companies that have been vetted by me and by some of my colleagues. And then we do e-blasts on a regular basis. We promote the discounted um, prices for all of the services and products that we have. And now we have over 50 different companies working with us. We have over 1,400 members, and staff can become members too. We have staples. And you can do even your coffee products for your practice through Staples. And it's about a significant discount with Staples, copy paper,
Mhm.
cartridges for your copiers, on and on, scrubs. We even have a discount on custom embroidery, for example, like if you want the name of the practice or the name of a technician on their scrubs. So all the way to OCT units and exam room chairs and services such as credit card processing services and employee benefit services. We really can provide practices with substantially decreased employee benefit health services um, w- because of the group that we can with which we can negotiate better discounts.
Mhm. And what would you say is different from this GPO and others? And or what maybe the better way to ask that is what are some of the objections that you might hear about people wanting to participate and how are you different? Because our experience is I think GPO is not a new concept. There's tons out there. But sometimes what I find, I'll give you an objection is you've got this product you use, it's less expensive with this GPO. This product, this vendor manufacturer is cheaper with this GPO. And so it's hard to pick. And I think at the end of the day, you just have to pick the one you feel most comfortable and that has the best prices for the ones for most of the products that you use. But have you heard that objection? And what do you think is different about how you guys have done it?
We don't have those restrictions because
Uh-huh.
I wanted to eliminate those walls. You can belong to other GPOs. We're not exclusive. We say purchase other products from somebody else. Maybe we don't offer those, or maybe you have a better deal. That's okay. But then we might have other products at better prices. Get those from us. So we're very inclusive with no borders.
Okay. And it also sounds like the types of things might be another differentiator because you mentioned some not just products, but like services, employee services, and things like that. That's unique. I haven't heard that one before. Uh, and and there's typically you said there's no cost, and our EMR vendor is also working on one that's integrated too. So there's a lot of different ways to slice and dice it. But I guess the fact is, if you're not part of a GPO, would your advice be like, "Well, you should try because you need
Absolutely,
to save
there's
money."
nothing to lose.
Right.
It's free, and even if you just get your copy needs, paper copier needs, or, coffee needs for your break room or scrubs
Mhm,
through us, you're going to save a significant amount of money. However, if you really delve into it, we have a very wide array of services and products from sutures to gloves to equipment, as I said, to exam room chairs, surgeon stools, patient technician stools, and on, to even down to website design companies and
mhm.
companies that help you get better ratings on social media. We have the whole gamut from A to Z.
So it's like a turnkey. If a new
Mhm.
provider wanting to come start a practice, they can say, "Hey, help me find all these vendors," because it is overwhelming, and that's where people like myself have to continue to do due diligence and try to continue to do better. And I'm assuming that as you get more members, you'll be competing for people that are part of your GPO that provide those services that are the tops in the industry
Exactly.
because that's what we want. That's what us as practices want. Like
Exactly.
we want the best.
And yep, I mean, companies come to us. I just got a text yesterday, actually, saying we have product X. Can we get on GP Ophtho?
Awesome.
For example, we have amniotic membranes at a very
Mhm,
reasonable cost. We have Bruder Mass because
mhm,
Bruder is part of our GP Ophtho Business Partner Network.
mhm.
So, for practices who sell equipment to their dry eye patients, we have a very wide array of those products as well.
So, like you mentioned, like the ambulance, do you think that in specific products, is there a certain practice size that it would make more sense? Because I think sometimes larger practices will have negotiated agreements because of volume that they
Mhm.
purchase or whatever. So, do you see that mostly where it's smaller to medium sized practices joining these GPS?
We've seen actually both because
Uh-huh,
even the larger ones may not have deals with some of the vendors that with whom we have partnered.
mhm,
So, they can continue using their other agreements for other items, but perhaps there's something that we have that they don't have. So they can still become a GPO film member unless their GPO requires, a restricted approach to that.
sure. Well, we've covered quite a few topics, challenges, ways to help solve them. If you had to give uh, somebody in a practice or a physician starting a practice or in experience some of those things, one piece of advice that they would take to thrive in the next 5 years in this market, what would you tell them?
I would say lean on your friends and colleagues. There are so many people in ophthalmology who want to help you. You should not feel alone as an island trying to do it on your own. Lean on your colleagues, lean on your mentors, lean on faculty if you've become friends with folks with whom you trained. And people are so willing to share their experiences, provide pearls, give you advice. You can then decide which makes sense for you and your practice and which may not. Some of it depends on your geographical location, your socioeconomic base of patients, and so forth. But I would say don't be shy about asking for help. Ophthalmology is a small yet very, very caring community.
Agree. Maybe you can tell them to listen to this podcast and learn a lot of stuff every week.
I'd be happy to.
Well, it's been a pleasure. Thank you so much for joining me, Dr. Matossian. I think you bring obviously a lot of experience and wealth of knowledge. So I appreciate you joining. Thank you.
Thank you very much. It was so much fun, and I really appreciate you asking incredibly thoughtful and provocative questions. Thank you, Guido.
Thank you. And thanks again to our listeners for joining us today. If you want to keep up with the podcast and the interesting conversations with our guests, don't forget to subscribe and please share us with your friends on social media. Another shout out to Boost Patients for producing the podcast. Boost helps new ophthalmology practices get more patients without spending a dime on marketing. You can learn more about them at their website, boostpatients.com, or check out the show notes. Hang in there, ophthalmology gurus. We'll get through this experience together. Have a great week.